I'm Catherine Calderwood. I'm the Chief Medical Officer in Scotland. I'm delighted to have this opportunity to offer my support for Thrombosis UK and join in celebrating World Thrombosis Day, which is a day designed to increase global awareness, care and research in thrombosis. I personally have a particular interest in research in thrombosis, as I've published a number of papers looking at thrombosis in pregnancy. In 2013 I was joint author on a research paper, a population-based study of venous thrombosis in pregnancy in Scotland between 1980 and 2005. Through the research, my medical role as an obstetrician and gynaecologist, and previously as National Clinical Director for Maternity Services and Women's Health in England, I know firsthand the serious risks of venous thromboembolism, and I've experienced the devastation caused to individuals, the preventable loss of life, and the tragic effects on families and their loved ones. Many cases of venous thromboembolism, especially those associated with hospital-acquired thrombosis, can be prevented, but only if we are vigilant in recognising it, carrying out routine risk assessment and providing early diagnosis and appropriate treatment. As Chief Medical Officer in Scotland, a key part of my role is to consider and address unwarranted variation in clinical practice to achieve optimal outcomes for patients. I want to try to better identify and manage clinical risk, and I want to ensure value for public money, preventing waste and preventing avoidable events. I place priority on patient safety, on improving mortality rates and reducing death due to preventable causes. Venous thromboembolism is a condition that can affect any age group or individual, although we know there are high-risk groups. Many events are the results of hospitalisation. In fact, around 60% of all VTEs are suffered by individuals who have recently had medical treatment in a hospital. Hospital-acquired thrombosis is a significant health concern for Scotland, where prevention is not fully established. We know women, especially during pregnancy, can be at greater risk, and that cancer patients are at far greater risk of developing VTE. So it's a condition we can often prevent, and when it does occur, we can treat it. As early as the 1970s, Scotland was a global leader in VTE. It was recognised on maternity wards where mums were no longer advised to lie in after giving birth, but to be active and mobile. This simple act of early mobilisation significantly reduced deaths due to VTE. Simple, saved lives, but we must and can do more. The greatest risk area is from hospital-acquired thrombosis. Evidence is clear. We should be carrying out risk assessment on every patient who comes into hospital for treatment. We should offer thromboprophylaxis to all patients assessed to be at risk of a blood clot. We must implement and monitor this across all hospital medical wards. I believe venous thromboembolism is a priority for Scotland. In partnership with NHS Scotland, our world-leading Scottish Patient Safety Programme and Thrombosis UK, we're carrying out an audit and review of current challenges and gaps. As a result of the data being collected by NHS Scotland, we will review this and offer support to health boards to implement guidance on the recording and monitoring of VTE events, patient outcomes and educational training opportunities. We will continue close liaison with Thrombosis UK, working to ensure that our work is not only informed by clinical evidence, but also patient experience and outcomes. Scotland has been a leader in obstetric thromboprophylaxis, but now it's time to place more attention on addressing the needs for thromboprophylaxis in all other areas. We're committed to gathering data that will better inform us on our management and procedures, committed to ensuring implementation of risk assessment on all hospital wards, and to ensure there's educational provision for patients and clinicians to have greater awareness, knowledge and confidence, effectively preventing and managing thrombosis. We need to support the increasing of general awareness and access to information, and we must reduce avoidable harm and preventable deaths. Through widespread implementation of risk assessment and thromboprophylaxis, not only are patients better protected, but unnecessary costs are saved. The evidence is clear. So on this World Thrombosis Day, October the 13th, I'm delighted to pledge Scotland's support and our commitment to reducing deaths and suffering due to venous thromboembolism.